Botox is toxic? Plastic surgery is only for young people? Today, we're back with another round of plastic surgery myths exposed, diving even deeper into the most common misconceptions about looking and feeling your best. From recovery time shockers to implant rumors that won't die, we're here to set the record straight. Stick around. This is one episode you don't want to miss.
Welcome to the Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, the Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Robert Graper, also known as the Doc Dudes.
Welcome to another episode of the Doc Dudes. I'm Dr. Garrett Harper, along with
Dr. Robert Graper.
And it's only the two of us. I feel
kind of cozy,
kind of intimate.
Yeah,
you know, I kind of like this.
Don't get strange on me.
Yeah, I know. Is that
because I'll go strange and it'll be just bad?
Is that your leg? Are you kicking me on it? What is that?
No, actually, that's not my leg.
All right, so we are board-certified plastic surgeons. If you caught our first plastic surgery myths exposed episode, you know we didn't hold back. And today we're at it again. Let's tackle more myths, break them down, and give you the facts so you can make informed decisions about your body and your health. So some of these are going to be quick answers, and some of them are going to be like, okay, let's get into it. The first myth that I am putting in my partner's hands,
capable hands,
is that plastic surgery is only for women.
It's not only for women, but predominantly used by women, mostly because women are smarter than men. We all know that. Women do all kinds of things. Men definitely do it, but they are probably 10% of the women. And what they do is noses, eyelids, occasional facelifts, liposuction, some breast reductions, which is a different thing than the women get, but gynecomastia is a fairly big thing.
Yeah.
And there just aren't as many men that avail themselves of the procedures.
Now, I will say you have done quite a many facelifts, male facelifts, the last couple months.
There have been a bunch lately, and that's a good sign, but compared to the women, it's still probably 10%.
Yeah, no doubt. And I think that obviously women's bodies go through far greater changes with pregnancy and things like that.
And society doesn't put as much pressure on men to look a certain way.
Right. That's definitely very true. I also would say, just kind of from a standpoint of like statistics, we certainly know that male plastic surgery is one of the fastest growing because it was so low before, right?
And
so
it works great.
Yeah, and you got to kind of put statistics in, in perspective when you start talking about, it's the fastest growing. It's still a smallish percentage of at least our practice, but I think plastic surgery in general, we are seeing more of it.
And don't you find that men are happy with their results?
Yes.
Yeah, they're just as happy as the women are.
I also think that some of the stigma about having plastic surgery is going away as we start making better decisions as plastic surgeons in society.
Especially about our diet.
Right, about our diet. But that also comes into play, right? The GLP-1s and the massive weight loss. I'm seeing a ton more male massive weight loss patients that have this excess skin.
Exactly.
And so it is increasing. It is certainly not just a women's game, but So myth number 2, you can't have plastic surgery if you're older. What do you think of that?
Well, I think different procedures have a different age point.
Sure.
So not very many 20-year-olds have facelifts, but a lot of 20-year-olds have lipo and breast dogs.
Sure.
And there are not very many 70-year-olds that have breast dogs, but a lot of them have facelifts.
That's right.
My oldest facelift was 85. Healthy. So it's not a chronological age, it's a physiological age.
Yeah.
And so, if you're healthy and you have a desire to change something and it's safe and effective, absolutely.
Yeah. Well, and we've got a whole host of people, patients that had maybe surgery a long time ago or had, older first-generation implants that they need removed or replaced or anything like that. And so we do see people who have had, implants placed 40 years ago. And so they were 30 when it happened. So now they're 70 and they don't want to lose all the volume in their breasts. So, I did a vertical thigh lift on a 71, 72-year-old the other day. So, I mean, she wanted to look great in shorts. All for it.
Yeah.
Have at it. So, it's not about how old you are, right? Because some 70-year-olds look like they're 40 and some 40-year-olds look like they're 70. Mm-hmm. So it's all about, is it safe to do? Do you have a definable problem? Do you have something that we can help you with? Is it safe to do? Do we think we can get match your expectations with the result that we can get? And so
dispelled that rumor.
Right? Myth number 3, Botox and fillers. It's the same thing. Like, and that's just it.
They're both injectables, but that's where the similarities end. Botox is a medicine used to stop the nerves from talking to the muscles. And when the muscles don't move, then the wrinkles don't form in the skin.
Right.
When you gather your smile the same way every time, which you do, then just like a piece of paper that folds over and over the same way gets a crease in it. And that's why we get creases in the skin. And it tends to happen when we're older because the skin's thinner as we lose protein. So that's why a 20-year-old doesn't have the wrinkles that a 70-year-old does.
Right. And probably doesn't need any adjuvant therapies to get rid of some of those fine lines like an older person
may. Whereas fillers are a volume agent, which is adding hyaluronic acid in what we use.
Which is a natural product in the body.
We have it all over our body, and it just increases the volume in typically the face, where we know over time aging produces volume deficits, so we just replace them.
Yeah.
Fast, effective, reversible.
I will say this, Botox and fillers, here's a good term, are synergistic, meaning that using both of them together, you will have a even better result, or they not only complement each other, but they actually kind of multiply each other's value.
Yeah, I'm glad you put that up. It made me think about when we first started doing fillers a while ago, and they were not cheap. And so people would put just one syringe of filler in, and they didn't like fillers. And it's like, well, because one wasn't enough.
That's exactly right.
So if you put 2 in or maybe 3 in, you walked out going, wow, I spent more money, but I love it.
Right.
Versus I spent a little bit of money and I can't see much difference.
Right. Kind of analogous to when we tell people, some of these skincare treatments are things that are series of 3s. So like you can't just go do one and then think that you're going to get some great result. It's wasting your money.
You and I've also said the analogy in food is like you go to a place and you get $12 hamburger and it's kind of this little thing and you go, wow, that wasn't very good. Well, $12 is still $12. Where you go someplace else, you get an $18 burger. You think, well, that's a lot of money for a burger, but it was good.
That's right.
It's the same a little bit with fillers. You pay a little bit more money and you're happier with what you got.
That's exactly right. Because you get the appropriate amount.
Now, and Botox, is toxic? Is it dangerous?
So, no. So Botox is a botulin toxin, but calling something toxic is way different, right? So Botox is an FDA-approved treatment. It's been used safely for decades. And what's crazy about Botox that a lot of people don't realize is about 90%, maybe even more, 95% of Botox isn't used in the cosmetic arena. Mm-hmm. It's used medically for other things, for other conditions, right? I mean, including migraine headaches, and there's other kind of muscular issues. That's exactly right. Spastic neuromuscular disorders.
Problems.
That's exactly right. And so only 5%, it's being used not just on like the cosmetic aesthetic patient, it's being used all over and is used safely, effectively. It's not dangerous. I mean, if you went wild on it, I guess anything could cause problems.
Exactly. I was
right?
about to say, if you have 25 units of Botox, it's safe. If you want 1 glass of milk, it's safe. If you have 250 glasses of milk, it's not safe.
Right.
So you can't do too much Botox in the same way. It's not safe.
Yeah, absolutely. So it's safe and effective for reducing wrinkles, even treating medical conditions like we talked about. Excess sweating, that's another area where they do it, right?
For patients, yeah.
Super
Works
cool.
great.
Yeah. And so the dose used in cosmetic procedures is usually way less than what's used in some of the other kind of conditions that it's used for medically. And so it's always below the toxic level. I mean, you're never going to walk into...
You couldn't afford to make it toxic.
Right, that's exactly right. You sell your house and your entire body gets Botox. But don't do that. Please don't do that. I'm not recommending that. I just contacted my attorney. I'm not recommending that, okay? Myth number 5. Breast implants, I heard you have to like get them replaced every 10 years.
Well, if you're working them hard.
I mean, right? You never know. Yeah. I mean, wear and tear. It ain't the age, it's the mileage, right? So no. So replacement of implants is not every 10 years. There's not a half-life. There's not a shelf life on these, especially the newer generation models, which are amazing. And those are what we call the gummy bear gel implants, right? Like the gel within the actual implant shell is cohesively bound together to where you can cut this in half with a samurai sword and nothing oozes out, right? So we don't get those huge like ruptures that we used to see back in the day, and then whatever kind of oozed out inside your breast pocket was like this honey molasses consistency. We don't get that. Basically what happened is they looked at all comers, all implant patients, and they said, well, when does 25% of these people require a second surgery? And it was right around that 10-year mark. But it's like, that's not really fair because it's not necessarily the implant's fault. It wasn't
an implant
right?
issue.
Right. So if the average age of an implant is 24, 25 years old, think about what happens in a woman's life between 25 and 35, typically, historically. That's when they're having kids. That's when breasts are changing, bodies changing, all those types of things. So they basically just looked at all the people. They didn't extrapolate for implant problems or ruptures or any of that kind of stuff. So you could get implants today and you could have them 40, 50, 60, 70 years. It all depends. I mean, if you go snow skiing and you yard sell it and land on your chest, probably you may have an issue, right? And so you can have complications down the road, but I just don't want people to think that they put an implant in and, oh God, in 10 years, I got to pay for this again, or I got to have this done. That is not true.
Now, what I would say, though, is, and you see this a fair amount as well, when we're doing something on someone and they're 15, 20, 25 years out from an implant, I think it makes sense to talk about changing them.
100%.
Even if they're not having a problem, because they're in their operating room and it's just so easy to do it and economical because you're not having a second surgery, second anesthesia, second recovery period. So when I see somebody who's coming in for a face or eyes or something like that, and they've got 15-year-old plus implants, I will always mention, think about this.
Yeah, sure.
And consider changing them out. It's like changing a tire, and that way it's simple.
So easy.
And painless virtually.
Simple. That's exactly right. Which brings on to the next myth, right? Plastic surgery always requires a long and painful recovery.
I don't think any of them are long and painful, other than perhaps tummy tucks. I do think are hard on people because big muscles but
obviously there's varying degrees. Yeah. Some people need a whole lot of muscle kind of work, and some people don't. I tell people
But isn't that your most tender procedure?
Oh, 100%. Well, yeah, and I mean, liposuction is one of those things where people are like, "Wow, that was kind of sneaky."
I don't think in lipo. In my experience, like people are like, "Well, I'm sore, like I worked out real hard."
Yeah,
but
it's more
breast
soreness.
dogs, now that you're putting
pain.
them on top of the muscle, they're not tender at all. That's a huge improvement. Breast lifts never were tender.
Yeah. I also think some of the longer lasting like injections, like the Exparel that we use for patients, which is a 72-hour pain anesthetic that we inject into the area of surgery, has changed the recovery process. I think, those first 3 days can be like
the hardest.
They're probably the hardest. And so now you've got a medicine that's injected into the surgical field that really numbs that area, or definitely like knocks it down considerably.
I think that helps, but most of the stuff we do, other than tummy tucks, which you use Exparel all the time, I don't even think needs it.
Yeah. No, I totally agree.
It's just not that tender.
Yeah. Yeah, I totally agree. All right. Myth number 7, plastic surgery is only about vanity.
I would say for my patients, and I'm sure you would agree, it's about confidence and how you feel. Just like you go out and put a new outfit on and it looks good on you, you feel better. Now, should you? I don't know, but I do.
Yeah.
And I think it's about the confidence, and everybody... Most want to look nice if they can.
Right.
And so, again, if it's safe and affordable and you care about it, it's like having a nice haircut. Who wants to go around with shaggy haircut or, bad old beat up rip sweatshirt.
Yeah.
Bill Belichick does, but not me.
Yeah, and he gets a 24-year-old girlfriend and the
Boom.
head football coaching job at Chapel Hill. So it's
Go
pretty good.
Heels.
Yeah, so plastic surgery, right? The concept and the idea of plastic surgery is a huge gamut of surgeries, right? I mean, we really are like the last bastion that operates head to toe, right? And so we have aesthetic cosmetic procedures, but if you're undergoing a cosmetic procedure and it makes you more confident and happier and more fun to be around because you just kind of have this different skip to your step now that you just love the way you look.
Yeah.
Like the whole world just
Energy
became
goes up.
happier, But we also do reconstruction, right? Like breast reconstruction and even reconstruction
Again,
after
makes you
massive
happier
weight loss. Right.
Because you're restored to where you should be.
That's exactly right.
It's again a confidence and happy feeling.
Yeah, and a quality of life thing. I think
Yeah.
it just like makes your life better. And we always love seeing patients who you not only see their physical transformation after we operate on them, but you see their emotional and psychological
and you take those
transformation.
pre-op posters or pictures just like I do, and man, you look at it, especially on the facial things, you see their face pre-op and it's a little concerned, or a little anxious, or something, and then afterwards they're like beaming. And
I know.
It's lovely.
I always love the occasional pre-op or post-op photo that our nurses will take, and maybe the bottom half of their face is in the picture and you see their pre-op and they're like kind of melancholy and like their corners of their mouths are turned down and they're just not happy and they're shameful almost sometimes. And then you see the picture in their post-op and there's a big gleaming smile. It's the best.
It's awesome.
Yeah. All right. So myth number 8, once you have plastic surgery, you'll need more later.
Well,
It's like a tattoo.
we're pretty good gatekeepers.
Nobody ever has one tattoo. You always got to
some
get
people
3
have
tattoos.
not.
Yeah, some have got a million.
I think we're pretty good gatekeepers about saying who should have it.
Right.
And again, you got to have a problem. You got to care about the problem. There's got to be a safe, effective solution.
Yeah.
You've got to be healthy. It's got to be affordable. And if it meets all those things, okay.
I would definitely say, though, what I have found is I think once a patient has had cosmetic surgery, plastic surgery, I think that their realization that some of these myths are so much different than reality and that their recovery was better, I think they're less nervous about a second procedure.
Well, and they may go, wow, that was so much better. What about this?
Correct.
And that's where you and I come in and go, that's really pretty good where it is. We're going to leave that alone.
That's right.
Or, if you care about it, yes, that can be better.
I love it. It always makes me think about like the patients that you do a breast reduction surgery on, right? And so you do a breast reduction surgery and they went from just having breasts that are enormous, painful, and you can't imagine how cumbersome it is to their life. And then you give them perkier, smaller breasts and they come in and they're like, I love my breasts, but what'd you do to my tummy?
Exactly. Where did that come
You're
from?
like, I didn't do anything to your tummy. You can just see it now.
Yeah.
But now we can address that. So those patients, it's another one where
well, where did I get these hips? I didn't have these hips before.
But sometimes they have plastic surgery and it's almost like this catalyst for a complete life makeover. It's not just a physical makeover. And so they come back to you after surgery and they're like, hey, you did X, Y, or Z on me. And I ended up really kind of, I don't know if it's a self-esteem or what it is, or a motivator, but like they just
confidence, self-esteem.
They come back and they're like, listen, I started eating healthy, hit the gym, and I've lost 20 pounds, and now I'd like to address this. And you're like, oh.
Well, or, that same confidence and self-esteem pushes them to maybe do better at their job or do better in their marriage or do better with their family.
Sure.
And it isn't the plastic surgery that did it. It's the confidence.
And the happiness.
And the self-esteem.
And you can't put a price tag on self-esteem and happiness, and those oftentimes go hand in hand, right? All right, what about myth number 9? Plastic surgery is a quick fix for weight loss. Don't you love it when the patient comes and says, I know I've gained 10 pounds since I saw you in consultation, but you were going to liposuction it anyways. So let's just do it. I think it's terrible, right? I think that there is no quick fix from a weight loss standpoint. I think weight loss is going to come down to nutrition, to habits, diet and exercise. And I think those things are not quick fixes. They can be more simple fixes than you think, especially with the advent of GLP-1s. I think that those have tremendously helped my patient population that might come in and be 30, 40 pounds overweight or 30, 40 pounds from their goal weight. And I say to them, all right, we could do your surgery today.
And if you did,
You'd have a good result.
And you'd do their breast reduction, and you do a tummy tuck. How much weight in total do you think that would remove of the 40 they need to lose?
Like 5.
Exactly.
Yeah.
That's why it's not a weight loss problem.
That's exactly right.
Program.
That's exactly right. But I do think that, the patients that I used to say, let's do your surgery 30 pounds from now, 5, 10 years ago, we wouldn't see many of them come back. They wouldn't be successful at that.
Totally.
Or they'd go somewhere else. And somebody would say, sure, I'll do it. I don't care. I'll take your money. And
they're not looking out for the
nowadays,
patient like you do.
right? But nowadays with GLP-1s, these patients are losing 20, 30, 40 pounds in 4, 5, 6 months. And so they come back and they've lost the weight.
They're a good candidate.
Now they're a rad candidate. They went from like, yeah, you'll look good to now I want you. I mean, it's amazing. And
awesome.
So it's not a quick fix. There are really great ways to lose weight in an appropriate amount of time. I'd never want to tell somebody, hey, you got 40 pounds to lose, lose 5 pounds a year and we'll see you in 8 years. That's not doable. But, getting a good nutrition plan, we have partnered with a really great physician that helps us and helps our patients in their weight loss journey too, which is just fantastic. Myth number 10, good skincare can eliminate the need for a facelift. What do you think?
I think skincare is a quality problem with the facial skin, and people who need facelifts have a quantity problem.
Sure.
Quantity, not quality, with skin, muscle, and fat.
Sure.
So they're two different components. And
Skincare ain't going to help your muscles.
No.
And muscle, I think, is one of the critical components, as we've talked about, to a facelift, right? So tell us how you restore the muscles of the face and neck when you're doing a facelift neck lift.
In the neck, we kind of tighten up the sling, which is the platysma muscle, and we pull that up and out to accentuate the jawline and eliminate the jowls.
Yep.
And then we pull that same extension of that muscle called the SMAS into the cheek, and that pulls the nasolabial folds, that cheek fold out. And it pulls the skin with it, so it's a 2-layer repair, reconstruction. And then on top of that, you do skin care, and some people will need chemical peels because they need a stronger treatment than a regular skin care will do. So we have a plan. We kind of know what's wrong and how to fix it, and then the plan works well.
But somebody who comes in that says, I want a facelift, and they're just kind of grabbing their skin, you got to tell those people that ain't the only problem.
Exactly. You got to make a diagnosis.
That's exactly right. So when you kind of restore the musculoskeletal positioning of a patient's face and neck and then redrape the skin over it, great. Now, 100% you want to protect that investment by doing good skincare afterwards.
Absolutely.
And we've got some of the best estheticians in the game to help you do that.
Well, and I would be doing skincare from the get-go, 20s, 30s, 40s, all the way through.
Absolutely.
To maintain your skin. And, you've always said skincare is like exercise. You want to exercise every day to keep the muscles and bones good.
Right.
Well, you want to do skincare every day to keep your collagen up, which keeps your skin thicker, which doesn't wrinkle. And it glows like furniture with 10 coats of varnish versus 1 coat of varnish.
Right. Now, I would definitely say that I think there's truth in saying that a good skincare regimen, which is going to include things like, procedures. Morpheus 8 is great. Halo resurfacing is amazing. BBL's amazing.
Turbocharge your regular skincare.
Yeah. And so once you get to the point, and the younger you are, probably the less you need those adjuvant things because you've got great collagen and elastin in your youth. But as we age, those are great ways to boost those things. So I think if you do great skincare, I think it can extend the time before a facelift may be right for you.
And sunscreen.
Sunscreen's huge too.
Huge.
No doubt about it. Myth 11, facelift scars are just bad. I mean, they're on your face. What do you mean?
Yeah, you know, we put them in the creases, and so you expect to see a crease there, or put it on the cheek-ear junction where you expect to see a junction point.
Right.
Scar hides beautifully. I mean, at 6 weeks, they're really good.
I mean, it's hard to even see. I mean, I think people don't realize that they've got natural creases like around their ear and around kind of their little ear nubbin and back in their hairline. You've got to go looking for it.
It's not an issue.
That's exactly right.
It's just not an issue.
Yeah. And so...
same is true of eyelid scars.
Oh, yeah.
Same is true of nasal scars. Same is true of brow lift scars. The breast reductions. You know.
But the face is a privileged organ. It's always going to heal better. I mean, we've seen countless studies. I had somebody that came in that's having Mohs surgery coming up, and she's super worried about it. And I told her, we used to do all these relaxing incisions and flaps and all this kind of stuff. And then a paper came out like 10 years ago, basically said, the face is really forgiving. Like if you just kind of close this primarily, give it time, it'll look great. And it does. Like they really do. They really heal beautifully. And all the scars are hidden anyways. So
I'd still like to put them in the lines of relaxed skin tension.
100%. Yep. Myth number 12, a blepharoplasty, which is eyelid surgery, will completely eliminate the wrinkles around the eyes.
I think that a static wrinkle versus an animation wrinkle, static wrinkles can go away with taking redundant skin away and improving the quality of the skin, but a animated wrinkle, 5-year-olds have.
Sure.
So,
And there's a reason that it animates, and there's a reason some wrinkles are like, it's not an aging thing. Some wrinkles are just your skin's over your muscle, and when your muscle contracts, this is what happens. Yeah. That's exactly right. So that's another kind of component where I think the use of Botox can help, right? Because people want, eyelids are eyelids, but when we talk about the crow's feet out like kind of laterally to your eyelid, when you smile real big or squint or do anything like that, Botox is a great adjuvant for that. Botox is great, a chemical brow lift to kind of raise the lateral aspect of your brow. Really, I think fundamentally works in concert with the eyelid surgery to get a better overall result. So I'm consistently sending my eyelid surgery patients, to the estheticians to make sure that they are protecting their surgical investment with the right skincare regimen that's specifically designed for the eyelids, but also to our nurse injectors who can use a couple of units of Botox to help eliminate some of those crow's feet and better position their brow that can open their eyelid even more, make it look even more youthful.
Love it.
If you've got questions or topics you want us to tackle next, visit us at ghsurgery.com and click on the Doc Dudes from the homepage. There's a link there to submit your questions and ideas, which are some of where we got these questions from. So we want to know what you have questions about. Don't forget to subscribe to the Doc Dudes so you never miss an episode. We drop a new one the last Tuesday of every month. Find us on Apple, Spotify, YouTube, anywhere you listen to podcasts. Follow us on Instagram and Facebook to stay updated on new episodes and the latest from our practice. We are so thankful that you all were able to enjoy this intimate discussion between Dr. Graper and I, sitting across from each other, just the two of us. Such a beautiful
Firelight chat.
Fire, that's exactly right. So this is Dr. Garrett Harper and
Bob Graper.
And we are saying we out from the Doc Dudes, and see you next time.